I'm
Mhm.
just curious also, when you specialize in pain pharmacy, pain management, those do they give you any training on how to communicate with patients, or is that just something you have to hone your skills at as you go along?
I think it's been both. I couldn't have had better mentors in my career that started when Sing Ping was a baby. So in my residency years, which residency for pharmacists is not required, if you want to work in a clinical setting, managing patients, it is the route to do that is typically through a residency, but by no means do you have to do it. People get hired from pharmacy school into clinical positions, but we were residents alongside medical residents, and I had my residency director at the time was also named Scott. It's a different Scott than was Sing Ping's, but the confidence he had and the effect he had on an interdisciplinary team was just like, it was amazing. And it was like, I could never fathom having that much confidence in helping a patient until that rotation. And I was like, I'm sold. I need to do this. And I want to care for these people. Pain management is not, nobody's knocking at our door to take our jobs. And I'm not saying that with like, oh, I'm bragging. No, it's a tough job and it does have burnout, but it's been great. And I had good mentors, but you do have to learn how to speak to them. And I had the medical doctors that were in our training and in residency that could talk very, very sternly about, life after traditional opioids. I still say that to patients, and I heard the doctor say that to them. And this is I finished residency as if it was like karma, or not karma, destiny for me to be involved in opiate stewardship when the opiate safety initiatives and all this regulation came down because of the peak of opiate prescribing and the issue going on. Now we're still 15 years later in an evolving opiate epidemic, but it's not the same as when I finished my residency. But it was like, I'm going to be doing this for the rest of my career, and I was just primed for it. But him being able to have the stern conversations really helped me in talking to patients on a like eye to eye level, being clear with them, and then having the palliative care side that's involved in all pain management residencies with pharmacy. It's pain management and palliative care, the compassion that's involved in that. And it's a perfect, I think, training opportunity based on where you are to be a very good, well-rounded provider. And that's what I am. I have provider status in how I do it. And I never would have thought I would have gone and gotten my DEA. Like I would have said, that's not happening. You can have all my savings. I'll bet it against you, kind of thing. And here I am managing patients, pretty much independently based on my scope of practice. So that was a long answer to your question.
Great answer though.